Question 1. What is the most important step a dental assistant should take before beginning instrument sterilization to ensure effective pathogen killing? A. Load the sterilizer to its maximum capacity. B. Visually inspect instruments for sharpness. C. Thoroughly clean and rinse all instruments to remove debris. D. Place instruments directly into sterile pouches. Answer: C. Thoroughly clean and rinse all instruments to remove debris. This question tests your critical knowledge of instrument reprocessing, specifically the essential preliminary step before sterilization. The keywords most important step before beginning instrument sterilization and ensure effective pathogen killing highlight the necessity of proper pre-cleaning. Sterilization cannot be achieved if instruments are covered in blood, saliva, or tissue, as these organic materials can shield microorganisms from the sterilizing agent. Therefore, thoroughly cleaning and rinsing instruments to remove all visible and microscopic debris is paramount for sterilization to be successful. For example, instruments must go through the ultrasonic cleaner or instrument washer to remove all bioburden before being packaged for the autoclave. Always remember that cleaning is the crucial first step for effective sterilization. Question 2. In the Fédération Dentaire Internationale (FDI) system, which tooth number represents the permanent maxillary left lateral incisor? A. Number 12. B. Number 22. C. Number 32. D. Number 42. Answer: B. Number 22. This question tests your foundational knowledge of tooth identification using the FDI, or ISO, notation system, which is widely used internationally. The keywords permanent maxillary left lateral incisor are crucial for precise identification within this system. In the FDI system, permanent quadrants are numbered 1, maxillary right, 2, maxillary left, 3, mandibular left, and 4, mandibular right. Teeth within each quadrant are numbered 1 to 8 from the central incisor to the third molar. Therefore, the permanent maxillary left lateral incisor is located in quadrant 2 and is the second tooth from the midline, making its designation number 22. Memorizing this system is essential for accurate charting and communication. Always remember that the first digit tells you the quadrant, and the second tells you the tooth number in FDI. Question 3. What is the primary purpose of a lead apron with a thyroid collar during dental radiography? A. To protect the X-ray tube from overheating. B. To reduce scatter radiation in the dental operatory. C. To shield the patient's reproductive organs and thyroid gland from unnecessary radiation. D. To assist the dental assistant in positioning the film. Answer: C. To shield the patient's reproductive organs and thyroid gland from unnecessary radiation. This question assesses your fundamental knowledge of radiation safety. The keywords primary purpose of a lead apron with a thyroid collar highlight its protective function. The lead apron is designed to minimize radiation exposure to the patient's radiosensitive tissues, particularly the reproductive organs, and the thyroid collar specifically shields the thyroid gland. This is a crucial step in adhering to the ALARA, as low as reasonably achievable, principle, ensuring patient safety during X-ray procedures. It does not protect the X-ray tube, reduce scatter in the room, collimation does this, or aid in film positioning. Always remember that the lead apron and thyroid collar are essential for protecting the patient from unnecessary radiation exposure. Question 4. Which of the following is the most common cause of syncope, fainting, in a dental office setting? A. Allergic reaction to local anesthetic. B. Acute myocardial infarction, heart attack. C. Stress and anxiety. D. Hypoglycemia, low blood sugar. Answer: C. Stress and anxiety. This question tests your critical knowledge of managing medical emergencies. The keyword most common cause of syncope, fainting, in a dental office setting points to a frequent patient reaction. Syncope, or fainting, is most often triggered by psychological or physiological stress and anxiety experienced by patients in the dental chair. This stress can lead to a sudden drop in blood pressure and heart rate, reducing blood flow to the brain and causing temporary loss of consciousness. While the other conditions are serious, they are less common causes of fainting. For example, a nervous patient might faint even before an injection, simply from fear. Always remember that for dental patients, stress and anxiety are the top reasons for fainting. Question 5. When mixing irreversible hydrocolloid impression material, alginate, what effect will using water that is too warm have on the setting time? A. It will have no effect on the setting time. B. It will increase the setting time, making it set slower. C. It will decrease the setting time, making it set faster. D. It will cause the material to become brittle. Answer: C. It will decrease the setting time, making it set faster. This question tests your practical knowledge of dental materials, specifically alginate manipulation. The keyword water that is too warm and effect on the setting time are crucial. The chemical reaction that causes alginate to set is temperature sensitive. Using water that is too warm will accelerate this chemical reaction, causing the alginate to set much faster than intended, which can make it difficult to mix properly and take an accurate impression. Conversely, cold water will extend the setting time. For example, if you use warm tap water instead of room temperature water, the alginate might start to harden in the bowl before you even get it to the patient's mouth. Always remember that warmer water makes alginate set faster. Question 6. What is the primary purpose of placing a dental dam during a composite filling procedure? A. To keep the patient's mouth open comfortably. B. To prevent the tooth from getting too cold. C. To isolate the operative tooth from saliva and contamination. D. To reduce the amount of local anesthetic needed. Answer: C. To isolate the operative tooth from saliva and contamination. This question tests your fundamental understanding of isolation techniques in restorative dentistry. The keyword primary purpose of placing a dental dam during a composite filling procedure is crucial. Composite resins are extremely sensitive to moisture contamination, saliva, blood. The dental dam provides unparalleled isolation by physically separating the operative tooth from the rest of the oral cavity, creating a dry and clean working field. This is vital for achieving optimal bond strength and longevity of the composite restoration. While it can also protect soft tissues and prevent aspiration, the main goal for composites is isolation from moisture. For example, when putting in a white filling, the dental dam ensures no saliva touches the tooth after it's been prepared and bonded. Always remember that the dental dam is essential for keeping the tooth dry and clean for composite fillings. Question 7. Which instrument is used to measure the depth of periodontal pockets and assess the gingival health? A. Dental Explorer. B. Cotton forceps. C. Periodontal probe. D. Amalgam carrier. Answer: C. Periodontal probe. This question tests your foundational knowledge of dental instruments. The keywords measure the depth of periodontal pockets and assess the gingival health are definitive clues. A periodontal probe is a slender, calibrated, marked with measurements, instrument specifically designed to gently measure the depth of the gingival sulcus, the space around the tooth, or periodontal pockets. These measurements are crucial indicators of periodontal health or disease. A dental explorer detects caries, cotton forceps grasp small items, and an amalgam carrier places filling material. For example, during a gum exam, the hygienist uses the probe to call out numbers, like 233, around each tooth to check for healthy gum depths. Always remember that the periodontal probe is for measuring gum pockets. Question 8. In the context of infection control, What does standard precautions mean in a dental office? A. Treating only patients with known infectious diseases as contagious. B. Assuming all blood and body fluids are potentially infectious. C. Using sterile gloves for all patient interactions. D. Disinfecting all instruments after use, regardless of patient risk. Answer: B. Assuming all blood and body fluids are potentially infectious. This question tests your critical knowledge of fundamental infection control principles. The keyword standard precautions is crucial. Standard precautions are a set of infection control practices that healthcare personnel apply to all patients, regardless of their known or presumed infectious status. The core principle is to assume that all blood, body fluids, excluding sweat, non-intact skin, and mucous membranes are potentially infectious. This approach aims to prevent the transmission of microorganisms from both recognized and unrecognized sources of infection. It doesn't mean only treating known contagious patients or using sterile gloves for everything. Always remember that standard precautions mean treating everyone as if they could transmit infection to protect yourself and others. Question 9. When considering a direct pulp cap, which material is generally preferred due to its ability to stimulate dentin bridge formation and its biocompatibility? A. Zinc phosphate cement. B. Composite resin. C. Mineral trioxide aggregate, MTA. D. Zinc oxide eugenol, ZOE. Answer: C. Mineral trioxide aggregate, MTA. This question delves into advanced endodontic materials and their specific applications. The keywords direct pulp cap, generally preferred, and ability to stimulate dentin bridge formation and its biocompatibility are definitive clues for mineral trioxide aggregate, MTA. MTA is a highly biocompatible material that is widely used and considered superior for direct pulp capping. It promotes the formation of a dentin bridge over the exposed pulp, effectively sealing and protecting it, and has excellent sealing properties. While calcium hydroxide, not an option here, also stimulates dentin, MTA is often preferred for its sealing and long-term stability. The other materials are not primarily used for this specific biological response. Always remember that MTA is the advanced material used to help the pulp heal and form a protective dentin layer. Question 10. When a patient experiences a seizure in the dental chair, the most appropriate immediate action for the dental assistant is to A. Restrain the patient's movements to prevent injury. B. Place a tongue depressor between the patient's teeth. C. Ensure the patient is in a safe position and protect their head. D. Attempt to wake the patient by shaking them. Answer: C. Ensure the patient is in a safe position and protect their head. This question tests your critical response to a medical emergency. The keywords patient experiences a seizure and most appropriate immediate action are crucial. During a seizure, the most important priority is to ensure the patient's safety by creating a safe environment around them. This means lowering the dental chair, removing any sharp objects or instruments from the area, and gently cushioning and protecting their head to prevent injury. Attempting to restrain movements or placing objects in the mouth can cause more harm. Always remember that for a seizure, patient safety and protecting their head are the top priorities. Question 11. Which term describes the gradual loss of tooth structure due to clenching or grinding teeth, bruxism? A. Erosion. B. Abrasion. C. Attrition. D. Abfraction. Answer: C. Attrition. This question tests your foundational knowledge of tooth wear processes. The keyword gradual loss of tooth structure due to clenching or grinding teeth, bruxism, specifically defines attrition. Attrition is the physiological or pathological wearing away of tooth structure as a result of tooth-to-tooth contact, such as during chewing, but primarily due to parafunctional habits like bruxism, grinding. Erosion is chemical wear, abrasion is mechanical wear from foreign objects, like aggressive brushing, and abfraction is caused by bending forces at the gum line. For example, a patient who grinds their teeth heavily might show flat spots on the chewing surfaces of their molars from attrition. Always remember that attrition is wear from teeth rubbing against other teeth. Question 12. What is the primary advantage of using a digital radiography system compared to traditional film-based radiography? A. Higher initial equipment cost. B. Longer processing time. C. Reduced patient radiation exposure. D. Requires chemical processing. Answer: C. Reduced patient radiation exposure. This question assesses your comprehensive understanding of radiography technology. The keywords primary advantage and digital radiography system compared to traditional film-based radiography highlight a major benefit. Digital sensors are significantly more sensitive to X-rays than film, meaning they require a much lower radiation dose, often 50 to 90% less, to produce a diagnostic image. This reduction in patient radiation exposure is a key advantage for patient safety. While digital systems have other benefits like instant images and no chemicals, reduced radiation is paramount. Always remember that digital X-rays mean significantly less radiation for the patient, which is a huge plus for safety. Question 13. When taking an alginate impression, where should the dental assistant stand in relation to the patient to ensure proper visibility and control when inserting the tray? A. Behind the patient, to the right side. B. In front of the patient, to the left side. C. Directly in front of the patient. D. To the side of the patient, at the 12 o'clock position. Answer: A. Behind the patient, to the right side. This question tests your practical knowledge of clinical assisting ergonomics and patient positioning for impressions. The keywords stand in relation to the patient and proper visibility and control when inserting the tray are crucial. For taking maxillary, upper, impressions, the dental assistant typically stands behind the patient, to their right side. This position provides excellent visibility of the patient's oral cavity and allows for stable, controlled insertion of the impression tray, especially when managing the lip and cheek. The specific positioning might vary slightly for mandibular impressions, but this is a common and effective approach for maxillary. Always remember that for upper impressions, positioning yourself behind and to the right of the patient gives you the best control. Question 14. What is the main characteristic of a localized allergic reaction, e.g., to latex gloves, that differentiates it from a systemic anaphylactic reaction? A. Difficulty breathing and swelling throughout the body. B. It only affects the area of direct contact. C. Rapid onset of symptoms within seconds. D. Severe drop in blood pressure. Answer: B. It only affects the area of direct contact. This question tests your critical ability to differentiate types of allergic reactions. The keywords main characteristic of a localized allergic reaction and differentiates it from a systemic anaphylactic reaction are crucial. A localized allergic reaction, such as contact dermatitis to latex gloves, primarily affects only the area of direct contact, causing redness, itching, or rash confined to that specific spot. A systemic, anaphylactic reaction is a severe, life-threatening response involving multiple body systems, characterized by widespread swelling, difficulty breathing, and a significant drop in blood pressure. Understanding this difference is vital for appropriate emergency response. For example, if a patient gets a rash only where their latex gloves touch their skin, that's a localized reaction. Always remember that localized reactions stay in one spot, unlike a body-wide systemic reaction. Question 15. What is the main advantage of using a perforated impression tray over a non-perforated tray for alginate impressions? A. It creates a smoother impression surface. B. It requires less impression material. C. It provides mechanical retention for the impression material. D. It reduces the setting time of the alginate. Answer: C. It provides mechanical retention for the impression material. This question tests your practical knowledge of impression trays and their properties. The keywords main advantage of using a perforated impression tray and alginate impressions are crucial. Perforated impression trays have holes designed into their surface. The primary advantage of these holes is that they allow the impression material, like alginate, to flow through and then lock mechanically into the perforations once set. This provides excellent mechanical retention for the impression material within the tray, preventing it from separating from the tray during removal from the mouth and ensuring a more accurate impression. It does not affect setting time or require less material. For example, when taking an alginate impression, the material squeezes into the holes of the tray, holding it firmly in place. Always remember that perforated trays give the impression material a mechanical grip. Question 16. What is the most critical instruction to give a patient immediately after a posterior composite restoration has been completed and light cured? A. Avoid chewing on that side for 24 hours. B. Do not brush the tooth for the rest of the day. C. The restoration is fully hardened and functional immediately. D. Expect some lingering pain for several days. Answer: C. The restoration is fully hardened and functional immediately. This question tests your practical knowledge of postoperative instructions for composite restorations. The keywords most critical instruction, posterior composite restoration has been completed and light cured, and immediately after are crucial. Unlike amalgam, which takes time to set, light-cured composite restorations are fully hardened and functional as soon as the light-curing process is complete. Patients can typically chew on them immediately. It's important to convey this so they don't unnecessarily restrict their diet or activity, though they should be mindful if local anesthetic is still active. Lingering pain is not expected from the material itself, and brushing is encouraged. Always remember that once a composite is light-cured, it's ready to go. Question 17. The primary benefit of using universal varnish, without fluoride, under an amalgam restoration is to A. Chemically bond the amalgam to the dentin. B. Provide a thermal insulating layer. C. Seal dentinal tubules and reduce microleakage. D. Increase the compressive strength of the amalgam. Answer: C. Seal dentinal tubules and reduce microleakage. This question tests your detailed knowledge of dental materials used with amalgam. The keywords primary benefit of using universal varnish, without fluoride, under an amalgam restoration are crucial. Dental varnish, when placed in a cavity preparation before amalgam, acts as a protective barrier by sealing the open dentinal tubules. This action reduces microleakage, the microscopic seepage of fluids between the tooth and the restoration, at the margins, and minimizes immediate postoperative sensitivity to temperature changes. Amalgam is retained mechanically, not chemically bonded. For example, after the dentist prepares a tooth for an amalgam filling, a small layer of varnish is often painted on the prepared surfaces to help seal them. Always remember that varnish under amalgam helps seal the tooth and reduce sensitivity. Question 18. Which of the following is an example of an extraoral radiograph? A. Periapical. B. Bite wing. C. Occlusal. D. Cephalometric. Answer: D. Cephalometric. This question tests your fundamental knowledge of radiographic classifications. The keyword example of an extraoral radiograph is definitive. Extraoral radiographs are taken from outside the patient's mouth to capture larger anatomical areas, such as the entire skull or specific jaw regions. A cephalometric radiograph, CEPH, is a common extraoral view, typically used in orthodontics to assess jaw relationships and growth. Periapical, bitewing, and occlusal films are all intraoral radiographs, meaning they are placed inside the patient's mouth. For example, an orthodontist uses a cephalometric X-ray to see how a child's jaw bones are growing. Always remember that extraoral means the X-ray film or sensor is outside the mouth. Question 19. What is the primary purpose of a festooning procedure when fabricating a custom acrylic provisional crown? A. To remove excess material from the gingival margin. B. To create the anatomical contours of the gingival embrasures and emergence profile. C. To bond the provisional to the adjacent teeth. D. To polish the provisional surface for smoothness. Answer: B. To create the anatomical contours of the gingival embrasures and emergence profile. This question delves into a specific detail of custom provisional crown fabrication, a more advanced assisting task. The keywords festooning procedure and custom acrylic provisional crown are crucial. Festooning refers to the process of carefully contouring and shaping the provisional crown to mimic the natural anatomy of the tooth and its surrounding gingival tissues. This includes establishing proper gingival embrasures, the V-shaped spaces between teeth at the gum line, and a natural emergence profile, how the crown emerges from the gum, to promote tissue health and aesthetics. While removing excess material is part of it, the main goal is this precise shaping, whereas bonding and polishing are separate steps. Always remember that festooning is all about sculpting that temporary crown to look natural and be kind to the gums. Question 20. What is the primary purpose of applying a base, e.g., zinc phosphate cement, under a large amalgam restoration? A. To provide additional aesthetic value. B. To chemically bond the amalgam to the dentin. C. To provide thermal insulation to the pulp and support the amalgam. D. To stimulate remineralization of the dentin. Answer: C. To provide thermal insulation to the pulp and support the amalgam. This question tests your understanding of the roles of various dental materials. The keywords primary purpose of applying a base, zinc phosphate cement, and large amalgam restoration are crucial. In deep preparations for large amalgam restorations, a base like zinc phosphate cement is often used to provide thermal insulation, protecting the dental pulp from hot and cold sensations that can be conducted through the metal restoration. Additionally, it provides mechanical support for the amalgam, helping to distribute chewing forces and reinforce the remaining tooth structure. It does not chemically bond, provide aesthetics, or stimulate remineralization. For example, the dentist might place a layer of zinc phosphate cement at the bottom of a large cavity before placing the amalgam filling to protect the nerve from temperature changes. Always remember that bases under amalgam insulate the pulp and provide support. Question 21. Which type of dental impression material is known for its irreversible nature, good elasticity, but poor dimensional stability over time, making it unsuitable for final impressions of crowns and bridges? A. Vinyl polysiloxane, VPS. B. Polyether. C. Alginate. D. Reversible hydrocolloid, agar. Answer: C. Alginate. This question tests your detailed knowledge of impression materials and their properties. The keywords irreversible nature, good elasticity, and poor dimensional stability over time, making it unsuitable for final impressions of crowns and bridges, are definitive clues for alginate. Alginate is an irreversible hydrocolloid widely used for preliminary impressions. While it's elastic enough to pull out of undercuts, its significant dimensional change due to syneresis, shrinking, and imbibition, swelling, means it must be poured quickly to avoid distortion, making it unreliable for precise final impressions requiring long-term accuracy. VPS and polyether have excellent dimensional stability. Always remember that alginate impressions change shape over time, so they need to be poured quickly and aren't used for crowns and bridges. Question 22. What is the most critical instruction to give a patient who is experiencing postoperative bleeding after an extraction? A. Rinse vigorously with warm salt water. B. Change the gauze frequently until bleeding stops. C. Apply firm, continuous pressure to the extraction site with gauze for 30 to 45 minutes. D. Drink hot liquids to help clot formation. Answer: C. Apply firm, continuous pressure to the extraction site with gauze for 30 to 45 minutes. This question tests your critical knowledge of postoperative care instructions for oral surgery. The keywords most critical instruction, postoperative bleeding after an extraction, and firm, continuous pressure for 30 to 45 minutes are crucial. The most effective way to control post-extraction bleeding is by applying direct, firm, and continuous pressure to the surgical site with a folded gauze pack. This pressure helps to form a stable blood clot. Rinsing vigorously can dislodge the clot, changing gauze too often prevents clot formation, and hot liquids can worsen bleeding. For example, tell the patient to bite down firmly on the gauze and only remove it after the recommended time to check if bleeding has stopped. Always remember that firm, continuous pressure is the best way to stop bleeding after an extraction. Question 23. What is the purpose of the proximal contact between adjacent teeth? A. To allow food impaction between teeth. B. To facilitate easy flossing. C. To stabilize the dental arch and prevent food impaction. D. To increase the tooth's resistance to decay. Answer: C. To stabilize the dental arch and prevent food impaction. This question tests your foundational knowledge of tooth anatomy and its functional significance. The keyword purpose of the proximal contact between adjacent teeth is crucial. The proximal contact is the area where the crowns of adjacent teeth touch each other. A properly formed contact point serves two main purposes. It helps to stabilize the dental arch by distributing forces and preventing teeth from shifting, and it prevents food from packing between the teeth, food impaction, which can lead to periodontal problems and caries. Poor contacts can cause food traps. For example, a tight contact between your two front teeth prevents food from getting stuck there when you bite. Always remember that good proximal contacts keep your teeth stable and keep food out. Question 24. Which of the following is a symptom most commonly associated with irreversible pulpitis? A. Sharp pain that immediately subsides after cold stimulus removal. B. Pain elicited only by sweet foods. C. Spontaneous, lingering pain after thermal stimulus removal. D. Pain that improves with hot liquids. Answer: C. Spontaneous, lingering pain after thermal stimulus removal. This question tests your critical ability to differentiate types of tooth pain for diagnosis. The keywords symptom most commonly associated with irreversible pulpitis and spontaneous, lingering pain after thermal stimulus removal are definitive clues. Irreversible pulpitis is characterized by pain that is often spontaneous, occurs without an external trigger, severe, and lingers for a prolonged period, seconds to minutes, after a thermal stimulus, like cold or heat, is removed. Reversible pulpitis causes sharp, quick pain that subsides immediately. Pain only upon chewing often indicates apical periodontitis. For example, if a patient drinks cold water and the pain persists for more than a few seconds, it strongly suggests irreversible pulpitis. Always remember that if the pain is spontaneous or lingers, it's likely irreversible pulpitis. Question 25. Which type of local anesthetic administration is best suited for anesthetizing a single maxillary tooth for a simple restoration? A. Inferior alveolar nerve block. B. Nasopalatine nerve block. C. Maxillary infiltration. D. Posterior superior alveolar, PSA, nerve block. Answer: C. Maxillary infiltration. This question tests your practical knowledge of local anesthesia techniques. The keywords best suited for anesthetizing a single maxillary tooth for a simple restoration are crucial. A maxillary infiltration, or local infiltration, injection is administered directly into the soft tissue near the apex of the root of the tooth to be treated. This technique is highly effective for anesthetizing single maxillary teeth because the maxillary bone is porous, allowing the anesthetic solution to diffuse through the bone to the root tips. Nerve blocks are typically for multiple teeth or larger areas. For example, before placing a filling on an upper front tooth, the dentist would usually give a small infiltration injection directly above the tooth. Always remember that for single upper teeth, infiltration is often the easiest and most effective numbing method. Question 26. What is the primary reason for performing a coronal polish during a routine dental prophylaxis? A. To remove intrinsic stains deep within the enamel. B. To strengthen tooth enamel and prevent decay. C. To remove plaque and extrinsic stains from clinical crown surfaces. D. To cure dental sealants. Answer: C. To remove plaque and extrinsic stains from clinical crown surfaces. This question tests your fundamental knowledge of preventive dentistry procedures. The keyword primary reason for performing a coronal polish during a routine dental prophylaxis is crucial. A coronal polish, using a prophy cup and abrasive paste, is primarily performed to remove soft plaque, food debris, and extrinsic, surface, stains that have accumulated on the clinical crown surfaces of the teeth. This improves aesthetics and removes bacterial deposits. It does not remove intrinsic stains, those within the tooth structure, strengthen enamel, or cure sealants. For example, after the hygienist finishes scaling your teeth, they will polish them to remove any remaining stains from coffee or tea. Always remember that coronal polishing is all about making your teeth smooth and removing surface stains. Question 27. When mixing gypsum products, what is the primary purpose of using a mechanical vibrator? A. To accelerate the setting reaction of the gypsum. B. To remove air bubbles and achieve a denser, more accurate model. C. To control the water-to-powder ratio precisely. D. To dry the impression material before pouring. Answer: B. To remove air bubbles and achieve a denser, more accurate model. This question tests your practical knowledge of dental materials, specifically gypsum manipulation. The keywords primary purpose of using a mechanical vibrator and gypsum products are crucial. When pouring models with gypsum, plaster, stone, mechanical vibration is used to eliminate trapped air bubbles from the mixed slurry. This process helps the gypsum to flow smoothly into all the details of the impression and compacts the particles, resulting in a denser, stronger, and more accurate final model. It does not accelerate setting, control the water-to-powder ratio, or dry the impression. For example, when you pour dental stone into an impression, you gently vibrate the tray on a machine to make sure there are no tiny air bubbles in the final model. Always remember that the vibrator is for getting rid of bubbles and making a perfectly dense model. Question 28. Which component of an X-ray film provides the image itself after processing? A. Lead foil backing. B. Outer package wrapping. C. Protective layer. D. Silver halide crystals in the emulsion. Answer: D. Silver halide crystals in the emulsion. This question tests your fundamental knowledge of traditional dental X-ray film components. The keyword component of an X-ray film provides the image itself after processing is definitive. The emulsion layer on the film contains silver halide crystals, e.g., silver bromide, silver iodide. When exposed to X-ray photons, these crystals store the latent, invisible, image. During chemical processing, the exposed crystals are converted into black metallic silver, forming the visible radiographic image. The lead foil backing protects from secondary radiation, the wrapping protects from light/moisture, and the protective layer safeguards the emulsion. Always remember that the silver halide crystals are the film that captures the X-ray image. Question 29. What is the primary ethical responsibility of a dental assistant when scheduling appointments for patients? A. To prioritize patients who have higher insurance coverage. B. To ensure fair access to care and accommodate patient needs reasonably. C. To schedule the most profitable procedures first. D. To only schedule appointments during the busiest times of the day. Answer: B. To ensure fair access to care and accommodate patient needs reasonably. This question tests your understanding of ethical principles in dental practice, specifically concerning patient access and fairness. The keyword primary ethical responsibility when scheduling appointments is crucial. Ethically, dental assistants have a responsibility to facilitate fair access to dental care for all patients and to reasonably accommodate their scheduling needs, respecting their time and ensuring continuity of care. Prioritizing based on insurance, profitability, or office convenience alone would be unethical and discriminatory. For example, if a patient needs an emergency appointment, the assistant should try to fit them in as soon as possible, regardless of their payment method. Always remember that fair access and accommodating patient needs are key ethical principles in scheduling. Question 30. Which anatomical structure is a small, soft tissue pad located distal to the mandibular third molar, which is a crucial landmark for mandibular denture impressions? A. Retromolar pad. B. Maxillary tuberosity. C. Mental foramen. D. Genial tubercles. Answer: A. Retromolar pad. This question tests your detailed knowledge of mandibular anatomy, particularly relevant to prosthodontics. The keywords small, soft tissue pad, distal to the mandibular third molar, and crucial landmark for mandibular denture impressions are definitive clues. The retromolar pad is a triangular-shaped soft tissue area located just distal to the most posterior mandibular molar. It is a critical landmark for the retention and stability of mandibular complete dentures, as the denture base must extend to cover this area adequately. The maxillary tuberosity is in the upper jaw, and the mental foramen and genial tubercles are bony landmarks. For example, a well-fitting lower denture will extend back to cover the retromolar pad, which helps prevent it from rocking or lifting. Always remember that the retromolar pad is that soft spot behind your last lower molar that's important for denture fit. Question 31. What is the main reason for using a curing light in increments when placing a large composite restoration? A. To achieve different shades within the composite. B. To reduce the amount of bonding agent required. C. To minimize polymerization shrinkage and heat generation. D. To ensure adequate adhesion to the enamel only. Answer: C. To minimize polymerization shrinkage and heat generation. This question tests your detailed knowledge of composite placement techniques and their underlying material science. The keywords main reason for using a curing light in increments and large composite restoration are crucial. Composite resins undergo polymerization shrinkage. They get slightly smaller as they harden. Placing and curing composite in small increments, layers, helps to significantly minimize the overall stress from this shrinkage, reducing marginal gaps, internal stress on the tooth, and potential postoperative sensitivity. It also helps control heat generation. It does not primarily affect shade, bonding agent amount, or adhesion only to enamel. For example, when filling a large cavity, the dentist will add and cure small portions of the material one at a time to prevent the filling from pulling away from the tooth. Always remember that incremental curing is done to control and reduce polymerization shrinkage and heat. Question 32. Which of the following is a common sign of acute, sudden, inflammation in the gingiva? A. Pale pink color. B. Firm, stippled texture. C. bleeding upon probing. D. Knife-edged margins. Answer: C. Bleeding upon probing. This question tests your foundational knowledge of periodontal health and disease. The keywords common sign of acute, sudden, inflammation in the gingiva are definitive. Bleeding upon probing, BOP, is one of the earliest and most common clinical signs of gingival inflammation, gingivitis, or periodontal disease. When the gingiva is inflamed, the blood vessels are engorged and more fragile, making them susceptible to bleeding even with gentle probing. Healthy gingiva is typically pale pink, firm, stippled, and does not bleed upon probing. For example, if the hygienist gently probes your gums and you see blood, it's a sign that your gums are inflamed. Always remember that bleeding upon probing is a key indicator of gum inflammation. Question 33. What is the most common route of disease transmission in a dental office without proper infection control? A. Direct contact with contaminated instruments. B. Airborne transmission of aerosols. C. Droplet transmission from coughing/sneezing. D. Indirect contact with contaminated surfaces. Answer: D. Indirect contact with contaminated surfaces. This question tests your critical knowledge of infection control and disease transmission routes. The keyword most common route of disease transmission in a dental office without proper infection control is crucial. While all options represent potential routes, indirect contact with contaminated surfaces, e.g., touching a contaminated light handle with bare hands, then touching a clean surface, is considered the most common way pathogens can spread in a dental setting if disinfection protocols are not meticulously followed. Direct contact, airborne, and droplet are also risks, but indirect contact is often subtle and widespread. For example, if a dental assistant touches a contaminated chair button without gloves and then touches a clean patient chart, they could spread germs. Always remember that contaminated surfaces are the silent spreaders if not properly disinfected. Question 34. What is the primary purpose of a diagnostic cast, study model? A. To be used as a permanent restoration for a patient. B. To fabricate custom impression trays. C. To analyze the patient's occlusion and plan treatment. D. To send to the dental lab for crown fabrication. Answer: C. To analyze the patient's occlusion and plan treatment. This question tests your fundamental understanding of dental procedures and materials. The keyword primary purpose of a diagnostic cast, study model, is crucial. A diagnostic cast, study model, is a replica of a patient's dental arches, usually made from gypsum. Its main purpose is to allow the dentist to analyze the patient's occlusion, bite, tooth alignment, existing restorations, and surrounding tissues outside the mouth. This static model is invaluable for treatment planning, patient education, and fabricating other appliances like custom trays, but it's not a restoration itself or directly sent for crown fabrication. That's typically a final impression. For example, a dentist might use study models to show a patient how their teeth will look after orthodontic treatment. Always remember that study models are your 3D map for planning treatment. Question 35. When taking a panoramic radiograph, if the patient's head is tilted upward, chin too high, how will the resulting image appear? A. The maxillary incisors will appear blurred. B. The condyles will be positioned superiorly. C. The mandibular incisors will appear elongated and out of focus. D. The exaggerated smile line will be visible. Answer: C. The mandibular incisors will appear elongated and out of focus. This question tests your understanding of common positioning errors in panoramic radiography and their visual consequences. The clue patient's head is tilted upward, chin too high, refers to an error where the Frankfurt plane, a line from the eye socket to the ear canal, is angled too high. This specific error results in the mandibular incisors appearing elongated and often blurred or out of focus. Conversely, a chin-down position causes an exaggerated smile line and foreshortening of mandibular incisors. Knowing how positioning errors affect image quality is crucial for identifying and correcting them. For example, if a panoramic image shows the lower front teeth looking stretched out, you would recognize the chin was too high. Always remember that a chin-up error leads to elongated lower incisors on a panoramic X-ray. Question 36. Which of the following is considered the safest and most common way for a dental assistant to recap a local anesthetic needle after use, if necessary? A. Two-handed recapping technique. B. Breaking the needle before recapping. C. Using a one-handed scoop technique or a recapping device. D. Bending the needle tip into the cap. Answer: C. Using a one-handed scoop technique or a recapping device. This question tests your critical knowledge of Sharp's safety protocols. The keywords safest and most common way for a dental assistant to recap a local anesthetic needle after use, if necessary, are crucial. The Occupational Safety and Health Administration, OSHA, strongly recommends against two-handed recapping because it poses a high risk of Sharp's injury. If recapping is unavoidable before disposal, the one-handed scoop technique, using the needle to pick up the cap from the tray, or using a mechanical recapping device are the safest methods as they keep both hands away from the needle tip. Needles should never be broken or bent. For example, after an injection, the assistant would place the cap on the tray and use the needle to scoop it up into the cap without using their other hand. Always remember that the one-handed scoop or a recapping device is the safest way to recap. Question 37. A patient develops localized redness and swelling around a recent restorative site. This reaction, occurring hours after exposure, is most likely a sign of what type of allergic response? A. Anaphylaxis, type 1 hypersensitivity. B. Contact dermatitis, type 4 hypersensitivity. C. Vasovagal syncope. D. Generalized urticaria. Answer: B. Contact dermatitis, type 4 hypersensitivity. This question tests your critical knowledge of different types of allergic reactions and their typical presentation. The keywords localized redness and swelling around a recent restorative site and occurring hours after exposure are key clues. This pattern is characteristic of contact dermatitis, which is a type 4, delayed, hypersensitivity reaction. Unlike immediate anaphylaxis, type 1, contact dermatitis manifests hours or days after exposure and is confined to the area of contact. Vasovagal syncope is fainting, and generalized urticaria, hives, is widespread. For example, if a patient gets a red, itchy rash on their skin where a new dental material or an adhesive touched them, and it shows up a day later, that's likely contact dermatitis. Always remember that localized, delayed reactions often point to contact dermatitis. Question 38. What is the primary purpose of placing a glass ionomer liner, not a base, in a cavity preparation? A. To provide thermal insulation and mechanical support. B. To release fluoride and seal dentinal tubules. C. To chemically bond the final restoration directly. D. To increase the overall hardness of the dentin. Answer: B. To release fluoride and seal dentinal tubules. This question tests your detailed understanding of dental materials, differentiating liners from bases. The keywords primary purpose of placing a glass ionomer liner, not a base, and cavity preparation are crucial. A glass ionomer liner is applied in a thin layer to primarily release fluoride, providing a therapeutic benefit against recurrent decay, and to seal the dentinal tubules. Sealing the tubules helps protect the pulp from chemical irritation and reduces postoperative sensitivity. While glass ionomer also has good adhesion and can offer thermal protection when used as a thicker base, as a liner its fluoride release and tubule sealing are key. For example, in a moderately deep cavity, a thin layer of glass ionomer liner might be placed before a composite to give some fluoride protection and seal the dentin. Always remember that glass ionomer liners are great for fluoride release and sealing those tiny dentin tubules. Question 39. What is the primary cause of periodontal disease? A. Genetic factors. B. Smoking. C. Bacterial plaque and calculus accumulation. D. Systemic diseases like diabetes. Answer: C. Bacterial plaque and calculus accumulation. This question tests your fundamental understanding of the etiology, cause, of periodontal disease. The keyword primary cause of periodontal disease is crucial. While genetic factors, smoking, and systemic diseases can all be contributing or modifying factors, the direct and primary cause of periodontal disease, gingivitis and periodontitis, is the accumulation of bacterial plaque, a sticky film of bacteria, and calculus, hardened plaque, on the tooth surfaces, both above and below the gum line. These bacterial deposits trigger the inflammatory response that leads to gum and bone destruction. Good oral hygiene is key to preventing this. Always remember that bacterial plaque and calculus are the main culprits behind gum disease. Question 40. When removing a temporary cement, e.g., temp bond, from a prepared tooth after a temporary crown has been removed, what instrument is typically used? A. Spoon excavator. B. Curette. C. Scaler. D. Composite finishing burr. Answer: A. Spoon excavator. This question tests your practical knowledge of restorative procedures and instrument selection. The keywords removing a temporary cement, e.g., temp bond, from a prepared tooth and after a temporary crown has been removed are crucial. A spoon excavator, with its sharp, spoon-shaped working end, is ideal for gently and effectively scooping or chipping away residual temporary cement from the prepared tooth surface without damaging the delicate tooth structure. Scalers are for calculus removal from non-prepared teeth, curettes are for root planing, and composite finishing burrs are for composites. For example, after the dentist takes off a temporary crown, you would likely use a spoon excavator to carefully clean off any leftover temporary cement from the tooth. Always remember that a spoon excavator is perfect for gently cleaning off temporary cement. Question 41. Which classification of dental caries describes decay that occurs on the occlusal surfaces of posterior teeth, or in the pits and fissures of any tooth? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer: A. Class 1. This question tests your detailed understanding of G.V. Black's classification of carious lesions, a fundamental concept for charting. The keywords Class 1 dental caries and occlusal surfaces of posterior teeth, or in the pits and fissures of any tooth, are definitive. A Class 1 cavity is located in the pits and fissures, which are the natural grooves and depressions on the chewing surfaces of molars and premolars, or in the lingual pits of anterior teeth. These areas are prone to decay due to their morphology. Class 2 refers to posterior interproximal, Class 3 to anterior interproximal, not involving the incisal angle, and Class 4 to anterior interproximal involving the incisal angle. For example, a cavity forming in the main groove on the top of a molar is a Class 1. Always remember that Class 1 means pits and fissures. Question 42. What is the primary function of the high-speed handpiece water spray? A. To lubricate the burr. B. To cool the tooth and burr, preventing pulpal damage. C. To keep the working area visible by rinsing away debris. D. To sterilize the tooth surface during preparation. Answer: B. To cool the tooth and burr, preventing pulpal damage. This question tests your fundamental understanding of dental equipment and its protective functions. The keywords primary function of the high-speed handpiece water spray are crucial. High-speed handpieces generate significant frictional heat during tooth preparation, which can cause irreversible damage to the dental pulp, nerve, if not adequately managed. The constant stream of water spray cools both the tooth structure and the rotating burr, preventing thermal trauma to the pulp. It also helps to clear debris for better visibility. For example, when the dentist is preparing a tooth for a filling, the water spray constantly keeps the tooth from overheating. Always remember that the water spray is crucial for keeping the tooth cool and protecting the nerve. Question 43. Which instrument is specifically designed for interproximal reduction, IPR, or creating space between teeth during orthodontic treatment? A. How pliers. B. Band remover. C. Diamond strip, proximal reduction strip. D. Arch-forming pliers. Answer: C. Diamond strip, proximal reduction strip. This question tests your specialized knowledge of orthodontic instruments and procedures. The keywords interproximal reduction, IPR, and creating space between teeth during orthodontic treatment are definitive clues. A diamond strip, also known as a proximal reduction strip or sandpaper strip, is a thin, abrasive strip used to carefully and precisely remove small amounts of enamel from the interproximal, side, surfaces of teeth. This procedure is called IPR and is often performed in orthodontics to create space for tooth alignment or to improve the aesthetics of crowded anterior teeth. The other instruments have different orthodontic functions. For example, an orthodontist might use a diamond strip to create a tiny bit of space between a patient's front teeth to help them align perfectly. Always remember that diamond strips are for carefully creating space between teeth. Question 44. What is the purpose of spore testing a dental sterilizer, autoclave? A. To confirm that the sterilizer is operating at the correct temperature and pressure. B. To verify that all internal chemical indicators have changed color. C. To determine if the sterilizer has successfully killed highly resistant microorganisms. D. To check for leaks in the sterilizer chamber. Answer: C. To determine if the sterilizer has successfully killed highly resistant microorganisms. This question tests your critical knowledge of infection control, specifically sterilizer monitoring. The keywords purpose of spore testing a dental sterilizer are crucial. Spore testing, or biological monitoring, is the most definitive way to determine if a sterilizer is truly effective. It uses highly resistant bacterial spores, e.g., Geobacillus stereothermophilus for steam sterilizers, that are subjected to a sterilization cycle. If these spores are killed, it provides the strongest assurance that the sterilizer is functioning correctly and is capable of killing all types of microorganisms, including the most resistant ones. Chemical indicators confirm exposure, and gauges show physical parameters. Always remember that spore tests are the ultimate proof that your sterilizer is actually killing everything. Question 45. What is the most critical instruction to give a patient regarding fixed orthodontic retainers, e.g., a bonded lingual wire, after orthodontic treatment? A. They can stop flossing the areas around the retainer. B. They need to be worn only at night. C. They are permanent and do not require further dental visits. D. Maintain meticulous oral hygiene, including flossing around the retainer. Answer: D. Maintain meticulous oral hygiene, including flossing around the retainer. This question tests your practical knowledge of post-orthodontic care. The keywords most critical instruction, fixed orthodontic retainers, and after orthodontic treatment are crucial. Bonded lingual retainers are designed to prevent orthodontic relapse, but they can make oral hygiene more challenging. It is absolutely critical for patients to maintain meticulous oral hygiene, including special flossing techniques, e.g., using floss threaders, and regular brushing, to prevent plaque and calculus accumulation around the retainer, which could lead to periodontal problems or decay. They are not worn only at night and still require regular dental checkups. Always remember that even with a fixed retainer, super careful cleaning, especially flossing, is vital to keep teeth and gums healthy. Question 46. Which tooth numbering system is commonly used in general dental practice in the United States, assigning numbers 1 to 32 to permanent teeth? A. Palmer notation system. B. Fédération Dentaire Internationale, FDI, system. C. Universal numbering system. D. Zsigmondy system. Answer: C. Universal numbering system. This question tests your foundational knowledge of tooth identification systems. The keywords commonly used in general dental practice in the United States and assigning numbers 1 to 32 to permanent teeth are definitive clues for the universal numbering system. This system is the standard in the U.S., numbering permanent teeth from 1, maxillary right third molar, to 32, mandibular right third molar, in a continuous sequence. The Palmer and FDI systems are also common but are used differently or in different regions. Accurate tooth identification is essential for proper charting and communication. Always remember that in the U.S., the universal system is your go-to for tooth numbering. Question 47. What is the primary function of a mouth mirror during a dental examination or procedure? A. To hold the patient's tongue. B. To remove plaque from tooth surfaces. C. To provide indirect vision, retract tissues, and reflect light. D. To apply topical anesthetic. Answer: C. To provide indirect vision, retract tissues, and reflect light. This question tests your fundamental knowledge of basic dental instruments. The keyword primary function of a mouth mirror is crucial. The mouth mirror is a versatile and indispensable instrument in dentistry. Its main functions include providing indirect vision, allowing the dentist to see areas not directly visible, retracting the tongue and cheek, to improve access and visibility, and reflecting light onto dark areas of the oral cavity. It is not designed to hold the tongue exclusively, remove plaque, or apply topical anesthetic. For example, the dentist uses the mirror to see the back of your molars, pull your cheek aside, and shine light where needed. Always remember that the mouth mirror is your all-in-one tool for seeing, moving, and lighting up the mouth. Question 48. What is the significance of the term bioburden in infection control? A. The amount of disinfectant used for surface cleaning. B. The number of microorganisms on a surface or object. C. The resistance of bacteria to antibiotics. D. The environmental impact of dental waste. Answer: B. The number of microorganisms on a surface or object. This question tests your understanding of key terminology in infection control. The keyword bioburden refers specifically to the number or amount of viable, living, microorganisms, e.g., bacteria, viruses, fungi, present on an object or surface before sterilization or disinfection. A higher bioburden makes sterilization or disinfection more challenging and requires more stringent cleaning. Understanding bioburden is crucial for effective instrument reprocessing. For example, instruments fresh from a procedure have a high bioburden of blood and saliva, which must be removed before sterilization can be effective. Always remember that bioburden simply means the amount of germs present. Question 49. According to environmental regulations, how should unused, encapsulated amalgam waste be disposed of in a dental office? A. As general office waste. B. In a sharps container. C. In a specifically designated, covered, airtight container for amalgam waste. D. Flushed down the drain with plenty of water. Answer: C. In a specifically designated, covered, airtight container for amalgam waste. This question tests your critical knowledge of hazardous waste management and environmental regulations in a dental office. The keywords in used, encapsulated amalgam waste and disposed of are crucial. Amalgam contains mercury, a hazardous material. Therefore, any amalgam waste, unused, encapsulated, or extracted tooth with amalgam, must be collected and stored in a specifically designated, covered, airtight container. This prevents mercury vapor release and ensures it is handled by a regulated waste disposal service, in accordance with Environmental Protection Agency, EPA, guidelines. It should never be put in general waste, sharps containers, unless mixed with sharps in a specific amalgam sharps container, or flushed down the drain. Always remember that amalgam waste needs a special airtight container for safe disposal. Question 50. According to CDC guidelines, what is the minimum recommended duration for vigorous hand washing with soap and water in a clinical setting? A. 5 seconds. B. 10 seconds. C. 15 to 20 seconds. D. 30 seconds. Answer: C. 15 to 20 seconds. This question tests your critical knowledge of fundamental infection control practices, specifically hand hygiene. The keywords minimum recommended duration for vigorous hand washing with soap and water and clinical setting are crucial. According to the Centers for Disease Control and Prevention, CDC, and other health organizations, vigorous hand washing with soap and water for a minimum of 15 to 20 seconds, some recommend 20 to 30 seconds, is essential to effectively remove transient microorganisms and prevent the spread of infection. Shorter durations are insufficient for proper decontamination. For example, when washing your hands between patients, you should lather thoroughly and scrub for at least the time it takes to sing Happy Birthday twice. Always remember that 15 to 20 seconds of vigorous scrubbing is the minimum for effective hand washing.